So for our overview, we're going to talk a little bit about the PPE, the equipment, the chemicals, the aspect of cleaning for health, and the difference between sanitizing, disinfecting, and outbreak response. So the first line of defense always, as an employee, as a student, a teacher, anybody, the first line of defense is washing your hands. It's the number one thing you can do. Healthy hand hygiene is crucial to staying healthy during cold and flu and any other illness season. So, what is recommended is that you sing happy birthday twice, 20 or 30 seconds while you are washing your hands. Now, I've tried this. It's very difficult. Usually, though, I can sing happy birthday at least once, and that's not too bad. But the point is, scrub your hands very well, wash your hands frequently during cold and flu season and any other outbreaks. Being proactive is very important in trying to reduce the pathogens, the dirt that the different pathogens can live on, and we will be going through some other trainings on how exactly we can best be proactive in our schools in cleaning touch points and desks and different areas that that are very critical in places that the kids are and that they touch. But again, that's another training. But the first thing that we should be looking at here is this cleaning process and being proactive. So after that, let's talk a little bit about personal protective equipment. It's very important that we always wear our nitrile gloves. That's just a good safety precaution. Sometimes having a dust mask is important too. Not getting splashed back into our mouth or areas like that. We tend to touch our mouth quite often. We don't realize that, in our nose, and even with gloves on, I've caught myself doing that. So having a mask on, dust mask, isn't a bad idea. And sometimes we do need that eye protection as well. So let's go over the equipment that we'll be using. First off, let's talk about handheld equipment. Here we have good old-fashioned spray bottles. Sometimes the old way of doing things, sometimes we gotta fall back to that. And if we need to, we've got spray bottles. Of course, you want to use a microfiber rag, and here I have a picture of a red one because most of the time the red ones are used in restrooms to do things such as, cleaning up those areas, the toilets and whatnot. Again, we're trying to deal with pathogens and such, so it's probably a good idea to use red rags for that. Whether you're cleaning a desk, whether you're cleaning a wall, if it's something to do with, again, suspected pathogens, I would use the red microfiber rag. Now, we have some pump-up sprayers that are available to us. And these are kind of a fun little technology. You put some water, or not water, but you put whatever chemical it is that you're going to be using in it. You close the top, you pressurize it, and it puts out a spray. A lot better than just a trigger pull spray bottle. But then we have this new technology, these electrostatic sprayers. And what's neat about an electrostatic sprayer, first of all, it's battery powered, lasts about 2 hours on a charge, will hold a quart of liquid. But with the electrostatic sprayer, it electrostatically charges each particle as it leaves the front of this sprayer. And the advantage to that is that causes it to adhere itself, just like a static cling. Okay, you ever had static cling? That's what it does. It will attach itself to undersides and cracks and crevices and all kinds of great places. So it's it really is the best thing to use in trying to get whatever liquid it is we're going to be using into every little nook and cranny that we possibly can. Now, portable equipment. We're going to talk a little bit about that. Microfiber pole mop, which some of you have and some of you have seen, and if not, it's something we're going to be doing more trainings on, and we're going to be using it a lot more as a custodian. Some people have, as you can see on the very far right, this restroom caddy. It's an aqueous ozone machine that dispenses aqueous ozone. And that's a training in and of itself. For those of you who have those, you know how wonderful they are and how they work. They are absolutely fabulous. And also carpet extractors. That's a portable machine. Just a regular carpet extractor, or the small ones, these little Vipers or George or whatever the little portable one is that you happen to have. These are very helpful in taking care of some of the events that we have to take care of. Let's talk a little bit about chemicals now. So for many years we had used hydrogen peroxide products as our go-to in dealing with well, different pathogens, and of course the good old ammonium quaternary compounds like spick and span. That's a much older technology. It's something you have to let sit on a surface for quite some time in order to get the kill claim that you're after. The peroxide also has some dwell time that you have to use. It's a safer product definitely than using a quat disinfectant. But now we have some better things out there. We have, for example, Pathogens. The Pathocide, which is a hyperchlorous-based product. It is made by a very natural process of electrolyzing water, and it turns it into two different streams, two different forms of water. One is called an analyte, the other is called a catholyte. And without being too terribly technical, but it splits the streams of water, creates two cleaning chemicals. One of them is actually a very good disinfectant, this hyperchlorous acid. Brew tabs or pure tabs, for those of you who have those. Those are a tablet that you put into water, they effervesce, and they create hyperchlorous through a chemical action as well. And hyperchlorous is the base, the root for sodium hyperchlorite, which is bleach. So although these smell like bleach, they aren't, but they have that disinfecting property that bleach has. So let's go over some definitions that you will need to know. First of all, cleaning. I know it's a very simple one, but cleaning. The definition of cleaning is physically removing all dirt and contamination, oftentimes using soap and water. The friction of cleaning removes most germs and exposes any remaining germs to the effects of a sanitizer or disinfectant that you might use later. Sanitizing is reducing germs on an inanimate surface. So not your dog, but inanimate like a desk, an inanimate surface to levels considered safe by public health codes or regulations. Sanitizing may be appropriate for food service areas, tables, and things like high chairs in daycares. Disinfecting is destroying or inactivating most germs on an inanimate object, but not bacterial spores. Disinfecting may be appropriate for things like diaper tables, doors, cabinet handles, toilets, and other bathroom surfaces. What is a detergent? You ever wonder what a detergent is? A detergent is a cleaning agent that helps dissolve and remove dirt and grease from fabric and surfaces. Soap can be considered a type of a detergent. Dwell time. This is something you all should already know, but dwell time is the duration a surface must remain wet with a sanitizer or disinfectant to work effectively. And germs. This is my favorite one because I call pretty much everything a germ. Microscopic living things such as bacteria, viruses, parasite, and fungi that cause disease. Let's talk about levels of cleaning. So, disinfecting, again, it kills germs on a surface or an object using a chemical. This process does not clean dirty surfaces or remove the germs, but It kills germs on a surface after cleaning and can be lowered and can lower the risk of infection. Sanitizing, going back to that, lowers the number of germs on a surface or object to a safe level, as judged by public health standards, to lower the risk of spreading infection. And cleaning. Cleaning is, of course, removing the germs, the dirt, and impurities from surfaces or objects. Cleaning works by using soap or detergent and water to physically remove germs from surfaces, but it does not kill them. So a lot of times you'll use something that is a cleaner disinfectant. Well, again, look at these terms and apply that to what it is you're using, and it comes out pretty quickly that it really is better to clean a surface first and then go back and either sanitize and disinfect with something that is a sanitizer or a disinfectant. Well, let's talk a little bit about sanitization levels in our school district and what we consider sanitization. Now, we're going to use the example of the pure tabs or the brew tabs when we look at the concentration and the dilution. Okay, so concentration of hypochlorous acid in this case. Sanitizer grade is 100 to 200 ppm. Disinfection grade, which is, it says hospital grade disinfectant claims. This will also kill H1N1 and the flu viruses, salmonella, and staph. This is what you would want to use if you are cleaning, say, in a restroom at any time. And you notice I put kind of a little yellow traffic light signal on that. But that's at about 500 ppms. And outbreak control. Now, that's what happens when there is a panic. This isn't something you use every day, mind you. Outbreak control is what you use when there are suspected cases of something like a bloodborne pathogen, herpes, polio, norovirus, MRSA, E. coli, HIV, Hep B, and Hep C. Okay? For outbreak control, that's where we bump things up to this little over 1,000 ppm of the hypochlorous, and we mark this with the red light. So kind of keep that in mind. Let's dive a little bit deeper into what these levels are in our district. So sanitizer. The frequency is daily. You should daily sanitize places like restrooms, cafeteria, library, auditorium, dressing rooms, and just other touch points. Okay, you should sanitize those on a daily basis. We're targeting rhinovirus, which is the common cold, and influenza. Pretty much you need to be wearing your gloves, and you can wear a mask if you want, and eye protection. It's really not totally necessary, but if you want to do it, please feel free to do that. But gloves, I highly recommend you use gloves when you do any of these operations. The equipment that you would use would be the microfiber rag, a spray bottle or pump-up sprayer, or the electrostatic electrostatic sprayer. Boy, I put gun in there. That's a terrible thing at a school. Holy cow. Anyway, the chemical you would use would be hydrogen peroxide, Pathogens, which is pathicide, or you'd use some of those tablets, the 334 milligram per quart. And you can see in the little picture here, the 334 are those little ones, about the size of an aspirin. You'd put one of those in a quart. And you see, according to our table here, to get to that 200 ppm, you put one of those in a quart, and it gives you that 200 ppm. Now, if you have the bigger tablet, the one that's more the size of, say, what is that, an Alka-Seltzer or an after-dinner mint, whatever you want to call it, that's the 3.3 gram tablet. And that's the one that comes in that kind of plastic tub. And you would put one of those into 2 gallons of water. Okay, so again, that's, wow, that's, if you want to break that tablet up, that's fine. But if you want to make up 2 gallons of sanitizer, great, there you go. And those great big ones, the ones like a miniature hockey puck, well, those are the 13.1 tablets. Those are great to go into a backpack sprayer. But if you're going to use it as a sanitizer, one of those will make 10 gallons of sanitizer. So keep that in mind. Uh, Disinfection grade. This is for cleaning bathrooms on a daily basis. Okay, if you are going to use a sprayer or spray bottle to clean your restroom on a daily basis, touch points, things like this. Again, we're targeting the cold and the flu, but this will also kill H1N1, it'll kill staph, it'll kill salmonella. Again, using your gloves is fine. If you want to use a mask and eye protection, that's fine too. But we do recommend you use your gloves. The equipment would be the microfiber rag, of course, a spray bottle or pump up sprayer or electrostatic sprayer, or that restroom caddy that you saw. That does a pretty good job of disinfecting in restrooms as well. The chemical, well, the aqueous ozone that comes from that caddy works very well in this operation. Or you would use one of the 3.34. Again, this is the one that comes from the tub here. You can see it on the far right. You use one of those in 2 quarts. And that gives you a little over 500 ppm. Okay, and this is the disinfection grade that we would use to clean restrooms and things such as that. Now for the outbreak. This is really something that, first of all, if you have a suspected outbreak, you need to report this to the custodial supervisory team. One of the people in the supervisory team, you need to let them know, hey, it's been reported to me that we have an outbreak of norovirus, or that we have an outbreak of MRSA, whatever it is. Now, outbreak control is a temporary thing. Okay, very temporary. Yes, you're going to clean areas daily. Actually, you're going to do it 2 or 3 times daily during outbreak control. You want people to see that you are out there being proactive and that you are cleaning off those cafeteria tables or those student desks or whatever area it is. But that outbreak control lasts for 3 to 5 days after the reported event. So for an example, you've got a bunch of students in a classroom, 5 or 6, that have the flu. They've reported that they're out and that they have the flu. Okay, so for the next 3 to 5 days, you will be at outbreak control level. And I say 3 to 5 days because what if this is on say a Wednesday or Thursday that it's reported? Well, you're going to clean really good on those days. You're going to clean good on Friday, and there's nobody there Saturday or Sunday. So that's where I get that whole, you're going to do it for 3 days kind of a thing. If this happens on, say, a Monday or Tuesday, well, yeah, you make sure that the rest of the week you are at outbreak control level of your frequency and your cleaning. And here, again, this targets influenza, norovirus, H1N1, staph, and salmonella, MRSA, HIV, Hep B and C, and the norovirus. Now for this, we recommend not only your gloves, but you wear a mask, a dust mask, and eye protection. Okay, this is a pretty safe chemical to be using. That's why we've introduced it to our custodial department, where so many other chemicals are toxic. But, this is still, keep in mind, this is still a chemical, and that we're going to be using this at a higher concentration now, and it's probably a good idea, just as a precaution, to have that mask so you're not breathing in any chemical. Okay? It's just kind of common sense. So for the equipment, of course, the microfiber rag, the spray bottle, pump-up sprayer, electrostatic sprayer, or the restroom caddy. The chemical will be the aqueous ozone from the caddy, or the tablets, you would use the 3.34, again, the one on the very far right here, but you would use 1 per quart. So that is 1 in the electrostatic sprayer. If you've got the backpack sprayer, well, the backpack sprayer will hold 2 gallons. You would use 2 of those larger, the hockey puck sized ones, for a gallon. Okay, 2 of those per gallon. So keep that in mind as we go to outbreak control. Cleaning bloodborne pathogens and other potentially infectious material. Anytime you clean up barf or feces or anything like that, you should do what? you should treat it as though it is infected because you have no idea. So just to be on the safe side, small or large spots or splatters, splatters, that doesn't sound good. Use your PPE, your safety glasses and gloves. Isolate the area with a wet floor sign or cones. Put a liner in a trash can, and make sure that the stuff that you're cleaning up you throw in, throw in there so you can bag it up. Spray the entire area with a disinfectant. Again, disinfectant grade of the chemicals we talked about. Wait at least 2 minutes. Use disposable wipes or a white terry cloth rag to wipe up the spill area. Place the wipes in the bag and then seal the bag and dispose of, and retreat the area with a disinfectant. For carpet cleanup, it's a little bit different. If somebody barfs on the carpet, let's say, use the Supersorb on the spill to, gellify it. We've talked about this before in part 1 of combating pathogens. Wait a couple minutes, scoop it up as much as you can, throw it in that garbage bag. Then you are going to disinfect that area. We'll talk a little bit about how we do that. So on carpet events, you want to do this as quickly as you can, ASAP, after an event. And an event, well, we all know what an event is. Not a fun event, that's for sure. We are targeting influenza, rhinovirus, H1N1, all of these bad things. I mean, there's a reason this kid barfed. Okay, there's a reason this person barfed. And usually it's one of these type of illnesses that it's causing this. So again, PPE full bore, your gloves, your mask, your goggles. You don't want to take a chance of getting any of this into your body. Equipment, the restroom caddy or carpet extractor. The restroom caddy does a great job on carpets, but if you don't have that, use your carpet extractor. The aqueous ozone from the caddy is a great sanitizer for sanitizing carpets, but again, if you don't have that, well, you're going to put one of those tablets at the 3.34 milligram, which is again the Alka-Seltzer size. You're going to put one of those per quart, and you're going to put it in your extractor. If you've got one of the small extractors, great, that's ideal. That works very, very well. But if you don't, if you just have one of the large extractors, well, you can still mix up, half gallon of water, a couple of quarts, and you want to be at that 1000 ppm. And then you want to go over your carpet and you want to extract that area and clean or sanitize that out of your carpet. Here's a little bit, here's a little piece about how to use the electrostatic sprayer. Here is a new piece of technology that is available to us in our department in aiding us to give another layer of protection against pathogens and the bugs, the illnesses that are out there. It is called an electrostatic sprayer, and we're going to show you how to use it properly. Main components to this sprayer is, as you can see, the tank, which is on the front, the battery that is in the bottom, and then the chassis of it itself. And in the very front, you have this nozzle that you can turn to get a different spray pattern, whatever it is you desire, the size of the droplets that are sent out. Now, this is an electrostatically charged sprayer, which means that the droplets that go out are going to cling to whatever they hit. Currently, the product that we'll be using in our electrostatic sprayer is made by Brulin. They're called Brew Tabs. And here on the right, you can see the tub that some of these come in, and it's a 3.34 tablet. It's about the size of an after dinner mint, but please do not try and use it as an after dinner mint. It smells like bleach. Anyway, you put this in the 1 quart bottle that is hooked to the machine and fill that up, and that will give you 1000 ppm of the product that you will be able to spray. And on the right, sometimes you'll see these little boxes that have this, this packaging with these little teeny ones that look like an aspirin. You'd want to put 10 of those in that same quart container to get the 1000 ppm, which is what we want to do for infection control. So you've got your product there, and you're going to need to put it in your jug. And how you do that is, first of all, you right here is the unlocking mechanism. So you unlock the the container, and then you're going to take that out. You're going to see that it's a 1 quart, and they aren't in blue like this. I just marked it so y'all could see this, but at the top it's 32 ounces, which is 1 quart. So again, one of those bigger tablets in here will give you that 1000 ppm. So you've got your tank off, you've dropped in one of the tablets, and now you're going to put water in it up to that 32 ounce line. Warm water works a whole lot better than cold water because the tablet will effervesce a lot quicker. So, here we go, and now we've put it back on. We have put the locking mechanism back in, and we wait. We wait for that minute, minute and a half for it to effervesce, and now it's ready to use. So we're going to take it out. We're going to spray it around the classroom, tables, chairs, touch points. You could use it in the cafeteria. You can use it in a meeting room. The point is, this will go and it will stick to these areas long enough for this 1000 ppm of hyperchlorous to wipe out whatever nasty germs are there. So we're giving that layer of protection for people who are coming into a room, students who are coming into a room. Again, this is a great technology and a great opportunity to help make our school a safer place as far as health. And what about those schools that have the clean core caddy, or that have the Pathicide, the Pathogens product? Well, you can dispense either from the caddy or from the Pathogens right into a little spray bottle like this, a pump-up sprayer, and put it in there, pump it up, go around, and again, spray tables. Here we are doing cafeteria tables between lunches. And this again helps that extra level of protection from the kids who were just there that may have coughed, sneezed, whatever on the tables to the next group that comes in. And here is one of our happy employees skipping through the cafeteria, causing a healthy, safe environment for the students to learn in. And finally, when you're done with the sprayer and you go to put it away, make sure you take the battery out of it. And it's preferable to not have water in that tank either. You can go ahead and pour that out because, it's only going to be good for a short time anyway. So go ahead and pour that out, take the battery out, and store it dry like this. Otherwise, we'll have problems with the battery. It will actually ruin this $70 battery. Make sure that you charge it thoroughly, put it on the charger, and charge it so that it's ready to go for when you need it. All right, folks. Well, that's the end of this training. Thank you for watching. And we would suggest that if you have any questions, you contact one of the custodial leadership team. This is kind of a work in progress. We're trying to be proactive. We're trying to move to more of a proactive approach to cleaning for health. So thanks again for watching.